Good afternoon, this is Dr. Do again. This video is on the alphabetically list of problems. We're on the category B, and today I'm going to talk about general summary of bacterial infection. Before I start to talk details, I just have some just input of what kind of signs you need to see the emergency room, what kind of sign you can schedule appointment, what kind of sign you can manage at home. Basically, for bacterial infection, you cannot manage bacterial infection at home unless it's a little pimple or a small pimple, or the folliculitis on your hair. Those small infection, very localized, doesn't bother that much. You can get the ornament from the over-the-counter antibiotic ornament, like try antibiotics or neomycin, anything like that. Other than that, if you feel any generalized internal infection of bacteria, you have to manage them. You have to be managed by the physician. So what kind of the signs you need to see the emergency? First of all, of course, fever. Could be very high, could be low, lasting for a long time. Not just 1 day, 2 days, 1 week, 2 weeks, continuously low grade of fever or high fever. And you feel very sick. Either the bacteria could infect the brain, the respiratory system, the digestive system, and the urinary system, and generalize in circulation in the blood. So all of these will cause very serious symptoms. First of all, you feel very sick. If it's in the brain, then you probably alter the mental status. You feel headache, fever, and projectile vomiting, like I said before. Or if it's upper respiratory system, or if it's lung, you feel fever, coughing, chest pain. If abdomen, you feel rebound pain, nausea, vomiting, or associated with urinary problems. So all of these signs, pretty much, especially the lung, the chest pain, difficulty breathing, or the headaches and high fever, feel very sick, and color change in the skin. These are the signs you need to see the emergency. Other than that, you feel sick, fever, and you can call your physician's office. They will guide you whether you need to go to emergency, or they will see you in the office. Anyway, what are the bacteria? What's the difference between bacteria and the virus? I think I talked before. The bacteria are small infective agent, can survive by themselves. The bacteria cause the disease. It's not the bacteria itself, but the toxins they produce, either endotoxin or exotoxin. Those toxins are circulating, released to the body, circulating in the blood, and those are the cause for why the bacterial infection usually feel more severe. You feel worse. You feel more sick compared to viral infection. And the exotoxin, sometimes could be worse. Like, for example, the tetanus. They have the predilection to special sites, the nerve root. So that's why you have the muscle spasm. So that's why the bacterial infection is so serious. There are different kind of bacteria based on the staining under the chemicals, hematoxylin and eosin. If they stay on the purple and the blue, they called gram-positive. If they stay red, they called gram-negative. And the different shape, rod or cocci, etc., etc. I'm not going to go on that details. In general, and also depends whether they need oxygen or does not need oxygen. Anaerobic, for example, tetanus, we know that's anaerobic bacteria. It's a bacillus. It does not live with oxygen. And there's another one, another class which is aerobic, has to have the oxygen in order to survive. And there's in between conditional anaerobic, for example, strep. Some of the strep belong to this category. Anyway, so different kind of bacteria has different characterize and different capacity, use different toxin to infect us. For the brain, the major one is, we all know, Neisseria meningitis. Cause the meningitis, the symptoms, headache, fever, and the meninges stimulation, which is projectile vomiting, your neck very stiff, and you may or may not have other neurological symptoms. But if this occurred in either young or old, if you have this kind of symptoms, you need to go see an emergency room. For the lung, of course, the strep, the Haemophilus, many kind of bacteria can cause lung infection, pneumonia. For severe pneumonia, the most common cause of pneumonia, of course, is the virus. But if it is bacteria, it tends to be in a specific lobar pneumonia. That's very severe, can have the pleural response, difficulty breathing, or pain with breathing, and coughing, of course, high fever. The fever cannot be suppressed by the medication, and associated with chest pain, coughing. If this kind of problem, you need to see, even though it's not emergency, you need to call your physician. They might tell you, go to emergency or go to the office. They will prescribe medication, antibiotics to treat it. For digestive system, or intra-abdominal infection of bacteria, mostly commonly the E. coli, gram-negative bacilla like E. coli or any other kind, diarrhea, peritonitis. We already talked about that last time. The pain is rebounding pain, and nausea, vomiting, diarrhea, could be bloody mucus diarrhea. So if that's the case, keep going for a while, a couple of days or a week. You need to see the physician or go to emergency room. And urinary tract infection, also the bacillus are the most common cause, different kind, gram-negative. Usually there's some symptomatic urinary tract infection in the young female or older female or male. For those people, you need, if you have urine frequency or pain, you need to see your physician, call them, and to treat the symptomatic urinary tract infection, because if it's ongoing, long-term, could have the complications like the nephritis, etc., etc. And the bacteremia, which means bacteria circulating in the blood. In addition to the toxin in the blood, the bacteria in the blood, that is very serious. Could cause very difficult to treat. If that's the case, you need to definitely be hospitalized to draw blood, identify what is the bacteria, and do the culture sensitivity, see which antibiotics is the best for you, and then treat you. Usually this kind of problem does not occur in healthy people unless you have a long-term exposure or special, or usually occur with those accommodate of other problems. For example, the long-term later cancer patient, or in the later stage of any other disease like kidney disease, or the chronic kidney disease, or the end stage of kidney disease, etc., etc., or the alcoholic lost consciousness, or sometimes may cause this kind of problem. Anyway, this is the general introduction, since we're on the big list, so I just put the bacterial infection in this video, not specific for any disease, but just the signs, the warning signs that you need to see the physician and or visit the emergency room. I think that is the take-home message. Do not hesitate, call your physician or go to ER to check it out. It could be life-saving. Alright, thank you for watching, and I will see you next time.